Hey guys, welcome to episode number 5 of Healing Humans. My name is Hugh Williams, and I don't matter, but the person that does matter is Sean. Sean Williams, Naturopath. So, hey, Shawnee.
Hey brother, how you going?
Yeah, good, good. Okay, guys, before we kick off, let's do our housekeeping. If you're watching this on Facebook, follow the Sean William Naturopath name back to his page and hit a like and follow so you know when the videos come out. And also on YouTube as well. So get in, hit the subscribe button and hit the bell button and you'll know when we release videos. Okay guys, so today we're talking about probably a very common problem for very, very young children, and that's tonsils and adenoids, and how it actually can be related to what we eat. So let's kick it off, Shawnee. What are tonsils and adenoids?
Um, I've been requested to do this. So for the people who have requested that I do this video, I hope this satisfies you. I hope this answers the question. But okay, so tonsils and adenoids. So your tonsils are in your throat, at the back of your throat, and your adenoids are up here in your nose. They are the lymphatic nodes of your sinus cavity and your mouth and your throat. They are the main lymph tissue that all your lymphatic system from the head down passes through on its way down to the kidneys. And so they are a vital part of what is effectively your immune system and your garbage removal system of your body. So basically removing them is not a great idea, but we'll discuss that in depth a little bit later. So they are effectively lymph tissue, a bit like lymph nodes that you find under your arms, in your groin, and in your neck. They're the exact same thing. They play the exact same role. Yeah, so, and I hope that answered that question enough.
All right, so why do they swell?
So why do they swell? Very often we call this infected. So why do they become swollen and infected? So first thing is usually due to the presence of trauma in the mouth area, the nose area. Obviously, when I talk about trauma, I'm not necessarily talking about blunt force trauma, these sort of things. So trauma can be anything from chemical damage to in things like food that set off your immune responses in your mouth and up your nose. This can be hay fever in small children. Even the slightest little bit of swelling can cause snoring, can cause a lot of, they don't get as bad as asphyxiation, but it can be that bad. But mainly anything like foreign objects, foreign bodies, such as, your bacterias, anything like that that pass through the mouth and pass through the mucous membrane of the mouth and the throat or the sinus cavity. These foreign bodies, they immediately find themselves in the lymph system, and in being there, they end up in the lymph system, and so they eventually make their way into the lymphatic tissue, which is the tonsils and the adenoids. Now, when that happens, you get a histamine response, and histamine response creates swelling. And so, sorry about that, guys, creates swelling. And so what happens is the swelling is designed to do two things. It allows white blood cells to enter the area. So they allow copious amounts of white blood cells and all those other immune factors to flood the lymph node, or in this case, a tonsil or an adenoid. And as they swell, you get excessive amounts of blood flow, lymph flow, white blood cells, immune factors. And the whole idea is to attack and break down that foreign object so it doesn't enter the bloodstream. That's the entire idea of the lymphatic lymph nodes and lymph tissue, is to destroy foreign objects. It's also there to remove dysfunctional tissue, damaged tissue. Anything that's damaged in the mouth or in the nasal cavity will find its way eventually into the adenoids or the tonsils, where large white blood cells will break down this dysfunctional or damaged or traumatized tissue. If you get a bleeding nose, for example, all that damaged tissue and the platelets, clotting factors, all those sort of things. Once they are no longer needed, once that capillary has healed itself from the nosebleed, all those clotting factors that find themselves inside of the wound will find their way into those lymph tissues like the tonsils and the adenoids, and will be broken down and recycled, reused, or excreted. But they are so important in, for example, the health of the mouth, the throat, and the sinuses. Without those adenoids, you're going to have a lot of sinus problems. And
it's interesting. It's interesting that you said that, Shawnee, because I'm jumping ahead tiny bit, but
yeah,
okay. You and I have both had our tonsils and adenoids removed.
We did.
And the interesting thing is that when I had my tonsils and adenoids removed, within 24 months, I was suffering horrendous ear infections. Do you remember that? Do you remember when we lived in Dubhead and had those horrendous ear infections? And I've been quiet now for a couple of minutes, and it's the thing that just sort of hit me in the sort of smarts, was that probably most of those chronic ear infections came from the lack of a lymph node within my mouth and nose. So it's very interesting. So yeah.
And like you said, those eustachian tubes at the back of your ears are connected to the back of your throat by the eustachian tubes. And so all that is it's all relevant, and we'll be talking about what causes the swelling. The main thing is, and do you remember what they used to feed us every afternoon in primary school in Wales?
Milk
every day. And so we now know from just anecdotally, I don't think there's been much in the way of clinical research.
There's been studies. We just will never know.
Yeah,
because the dairy industry will not allow that stuff to be released. But anyway,
we know from an empirical, so meaning in clinic, in practice, and we know from anecdotally from talking to people that when you remove milk, cheese, and these very sugary foods from a child's diet, the first thing we notice is that the tonsils stop swelling, the adenoids stop swelling, the ears stop blocking, and it's well, we could say it's amazing, but the truth is it makes perfect sense.
It's normal.
Milk is it creates a lot of mucus. It creates a lot of phlegm, especially in that upper respiratory area right here in the face. It's terrible for doing that. This is why one of the first things I advise all my clients to do is to get rid of the dairy, the milk, the cheese, the yogurts. Although, to be honest with you, I haven't seen yogurts make a huge impact the way that milk does. I'm not entirely sure why. But for some reason, the milk and the cheese, especially the milk and the huge quantities of the milk and the cheese that we eat as children, it becomes a huge staple in our childhood diet because it's easy to eat, it's tasty, and we're used to drinking something like milk since birth. So but we have this drink which is very high in lipids, it's very fatty, very high in and very high in calories as well, because it's designed to take a 30 kg calf, turn it into a 300 kg cow. So it's very high in all the nutrients are out of balance for humans, if that makes any sense. They're perfectly balanced for a cow, but not balanced for a human being. And so what happens is we just become very phlegmy, very mucousy. And that mucus is just basically our body trying to detox. And so for a lot of children, especially, this overconsumption of milk just causes the tonsils to swell, the adenoids to swell, the ears to block, and you take them off that. It takes a little while. It takes a good 3 to 6 months to see permanent reversal, but eventually the swelling and that stops, it's usually the big one, milk. Absolutely.
It's going to take a long time. It's going to take a long time to reverse 100 years of nutritional disinformation.
It is. And by the time most children have gotten to 4 or 5 years old, they're already on the back foot. They've been drinking dairy-based formulas, and and then going straight onto milk. And so, I know with my own children, I never put my children on milk. Actually, that's a lie. I put the first one onto milk, but then when I had the second child, we were educated enough to know not to do that. And the difference is amazing. Like, my youngest doesn't have any issues the way that the first one did. No problems with hearing, no problems with like tonsillitis or anything like that. And we were educated enough by the time my oldest was about 12. We were educated enough to take that out of the diet. And so we never saw tonsillitis. We never see ear infections. We never see, like runny noses and really swollen adenoids. It's something that we haven't experienced, and yet we experienced it as children, all of us, including our parents as well. And if we go on the whole thing of, genetics or family history, we should all be suffering, and my children should be even worse than we were. But,
because we were bad. Didn't you get it done twice?
Yes, I got my adenoids removed and tonsils removed, and then I had grommets. I had the ear, what do you call it, the drain plugs in the eardrums.
Yeah.
The grommets, had that done twice. So that was first done at 3 and then done at 7, I believe it was. But my children have had none of that. Never had any issues, and this is because we don't have milk in the house.
Yeah.
But I mean, for people who milk is such a staple in their diet, I would advise going to a milk alternative like coconut or rice milk or oat milk. Then you got
I think soy milk tastes better than actually normal milk. So it has a much more creamier taste to it, soy milk. So are you gonna tell me I can't drink soy milk?
No, absolutely not. There's nothing wrong with soy milk.
You had that look. You had that smile. Like, you like this? I'm gonna ruin it. Okay, so that's good. Okay, yeah.
No, not at all.
But soy milk, you can always find a milk that inspires your taste. So you don't have to drink dairy.
No, like for us, it's coconut milk and oat milk.
I don't know what it's called in English.
Say it in Danish. Somebody will do. Somebody will translate.
I think the Minister for War and Finance is translating it now. I think she heard us and she's translating. Are you translating, honey? Oats. It's oat milk.
Yeah. Okay. Cool. Oat milk. Oat milk is good. Yeah, I don't mind it. It's it doesn't have that nutty flavor like almond or cashew.
Yeah.
But which some people really enjoy, but it's just not my flavor. I'm more of an oat, rice, coconut milk type man myself. But yeah, absolutely, you can 100% use it. It's really good. But the other thing was tonsil stones. Somebody was asking me about tonsil stones. So I got to make sure I mention these because somebody actually did actually ask me. But yeah, I think I can hear a phone going off in the background there. I hope you can't hear that. But
I can't hear it.
Basically, tonsil stones. I got asked about tonsil stones, so I have to mention this. So tonsil stones is when your lymph node is, how can I best put it? When you sweat under your arms, you smell.
Yeah.
Tonsil stones is sort of the same thing. It's lymph node excretion. It's when your lymph node lets out that cottage cheese sort of a look, which is a combination of lymph fluid and coagulated white blood cells. It's an immune
response.
Yeah, it is the end of immune response. So the immune response has happened, and so that coagulated cottage cheese stuff that comes out of your tonsils that you call tonsil stones, that's your body excreting the end result. It's getting rid of now. Not particularly nice, pretty disgusting, but your body's pretty much been destroying, well, whatever the foreign object be it, like milk, a lot of the stuff in milk, that sort of stuff. And the dairy and things like that, it's just a response to, I believe it's the lactose and certain, what's it called? Casein protein in milk as well. your body just doesn't react well to it, and so tries every way it can to excrete it. And the milk lines your mouth and it gets into your throat. It absorbs in several areas, so it coats it. And so, yeah, that's your body trying to excrete it also. But yeah, so my advice to a lot of people is get rid of the milk, get rid of the dairy, and the tonsils and adenoids, they begin to shrink. Yeah.
I think another good advice as well would be to don't react to the problem. So if your child starts to show signs of a sore throat and stuff like that, don't suddenly then decide to remove dairy from your lifestyle, because like you said, it will take 6 months for there to be an effect. And I think that's the most important thing about preventative medicine, is that it takes time.
Yeah.
Or if you're symptom free, you'll never know when it started to react, like when it started to change your body, because you're symptom free. But the most important thing is that you start to practice preventative medicine so that your children won't end up with tonsillitis and adenoids problems. Because when you get tonsils or adenoid infection and you decide to take a natural approach to it, it takes time. And having a sick child who has an infection, the first thing that you want to do is go out, remove the symptoms and just carry on with life. But really it's about changing diet. And without diet you can't and if you don't change the diet, you will mask the symptoms, but it will probably most likely return time and time again until you have a reoccurring tonsillitis throughout the child's life. Yeah, does that sound
absolutely
like a good? Yeah, that's what I learned in the last 5 minutes.
In adults. So tonsillitis can be quite prevalent in adults as well. So one of the things and it's the same thing, it's milk, get rid of the milk, the dairy, etc., etc. But there are a few other things to add to that as well. So the first one is the smoking, or if you're around people who are smoking. Sore throats, tonsillitis is a common thing for smokers. Not all smokers, but a lot of them do get it. The other thing as well is high sugar diets will do it as well, like refined sugar diets. If you're drinking a lot of energy drinks, that sort of thing, it has the exact same immune response happens as milk. My advice, if you are getting these recurrent sore throats and they're saying, swollen tonsils, swollen glands just under here as well, very often check what you're eating. It's very often the problem. So yeah, reversing with the tonsillitis and that snoring from the swollen adenoids, it's diet. We understand that. Very few people are, I guess, unaware enough to not understand that now. I believe a lot of people know that. But having said that, I get a lot of people asking me that as well. But these days it comes out more like, my boy's got is getting tonsillitis all the time and the doctors are talking about cutting out his tonsils. Is it the milk? That's usually what I get now, whereas years ago it was, what's causing this? But there's more of an understanding that now than there was. Yeah, there's a shift in the paradigm now. Everyone's understanding that everything is related to diet. With I think the main thing with going back to the milks as well, with the alternative milks, like the plant-based milks, is when you are choosing an alternative to milk, the first thing you need to be aware of is those hidden additives. So check for numbers. I know when I go there myself, I like to have a bit of a browse, because I only buy certain brands. And so I like to pick up some of the other brands off the shelf and just have a look at them and see what's in them. And I see numbers. Also, some of them will be fortified. So when you have a supermarket brand product like milk, or in this case, let's use soy milk for an example, very often, because it's done by a large company, they're under certain guidelines where they have to fortify their foods. And so soy milk is one of them. Very often is fortified with calcium carbonate. or it is sometimes it's done with like bread, for example, has iodine in it, which allows which is supposed to reduce the amount of thyroid issues that we have, but it doesn't. but yeah, so you will find some of your milks that you're looking at will be fortified with calcium carbonate. It's not necessarily a bad thing. Don't let that scare you off it. It's mainly the numbers. Look for the numbers and added sugars, anything like fructose corn syrup, anything like that. Natural sweetener, yeah, emulsifiers, anything like that. Check for those. If you find those, put it back on the shelf. Keep looking. You'll find something eventually where it's literally just coconut milk or rice milk, coconut water, sea salt. That's it. You know, you'll find a product like that. You may pay a little bit more, but it's better for you.
Yeah.
Yeah, absolutely. Yeah.
All right, so should we get to the surgery now, Shawnee? Should we talk about, is it recommended to have surgery?
All right, surgery.
No.
It's interesting. Sorry, bro, I didn't mean to interrupt you. What
No, sorry.
So
said by.
the surgery is interesting. Okay, sometimes it's necessary for quality of life, which I believe is, for myself anyway, it's the central tenet for what I do is quality of life comes first. But if you can reduce the swelling of those tonsils first, I'd prefer that over surgery. If I can just give you an example as a father, let's say Harley's 5 years old, you come in to the doctor and the doctor says, oh yes, his tonsils and his adenoids are swollen. We're going to have to do an tonsillectomy and an adenoidectomy. And you're like, oh, okay, yep, no worries. It sounds quite reasonable, doesn't really sound very scary. And so, yeah, you're like, oh, okay. Now, here's scenario number two. You rock into the doctor, 5-year-old Harley, he has to look at him and he goes, tonsils are swollen, adenoids are swollen. Now, listen, we're going to have to remove part of his immune system.
Yeah.
It's a little bit of a different story when you say it like that.
Yeah.
First question is, doesn't he need that? That immune system sounds pretty important. Why are you taking out his immune system? Isn't he going to need that? Oh, no, he doesn't need that. It's like, when someone says, oh, he doesn't need his tonsils and adenoids, they're just redundant tissue that we don't actually use. But when you say, it's his immune system, no, he doesn't need that. It's like appendixes. They're the main lymph tissue. They're the tonsils and adenoids of the gastrointestinal tract. So that's what an appendix is. It is the lymph tissue of the GI tract. And so taking that out is like taking part of your immune system out. Some people are fine, no big deal. Other people will experience, major gastrointestinal tract issues after they do it.
After surgery. Wow.
5 to 8 years later, they've got gastrointestinal issues and no one's put one and one together and realized, oh, you had your appendix
You've got no immune system. You've got no immune balance within your intestinal tract.
And it's like a stepping stone. It goes appendix, and then about 12 to 15 years later, the gallbladder goes, and then probably 5 years later, the liver starts shutting down.
Wow.
Yeah.
And they're, again, anecdotal, or is that actual studies done on this?
No, they don't study these things. You just begin to put the pieces together as you're practicing, and you talk to people, and you say to somebody, oh, when did you have your appendix out? They're like, oh, how did you know I had my appendix out? It's like, because your gallbladder's mush and you had that out too. It's all like a chain, one after the other.
Yeah, that's right. It's one support system collapsing after the next, and then you're just,
So those adenoids, and now the interesting thing is, I've been told that tonsils will grow back. So if they don't get the entire tissue of the tonsils, if they even leave a tiny bit there, the body will actually grow them back over time.
Important?
Yeah, I was actually at a doctor's appointment one day. I think I was trying to get I think I was trying to get a doctor's certificate to take some time off work or for whatever reason. And he just happened to look down my throat and he goes, "Oh, it looks like you got a bit of tonsillitis." I'm like, "I don't think so, mate. I had mine taken out when I was 5." And he's like, "They're definitely there." And I gave
Wow.
him my phone and he took a photo and he said, "Yeah, look at that." And there they were. They're not as big as most people's. Like they don't protrude out the side of the throat as much, but
Yeah.
they're definitely there. So I was like, "Oh wow, that's really interesting." It's interesting, but it doesn't surprise me. So obviously
Yeah. But
when they
it's interesting that the body won't grow teeth, but it'll grow back, a lymph node. So it shows the importance,
mm,
of the lymphatic system. It won't grow back a finger, but will grow back a tonsil. So anything that regenerates in the body like that is important.
yeah, and I found that really interesting because he couldn't tell me why, and I couldn't tell him why. It was pretty amazing, but they were definitely there, and I definitely had them taken out when I was 5 or 3.
I was there.
3. Yeah,
I was there.
I
I
definitely
remember.
got
Yeah.
them taken out. So that intrigues me. It really intrigues me, the possibility that you can regrow lymph tissue, and it's really important because the lymphatic
Because the
system
lungs
is a
regenerate
sewer.
as well, don't they?
They do, and the GI tract does too.
So
Mm.
anything that regenerates in the body is of the highest importance. Like you
Yeah.
could call it like the top echelon of systems within the body. So like
Mm.
you can lose an eye. So you wouldn't be able to catch something coming at you because of depth perception problems. But the body doesn't regenerate the eye because
No.
you can still live without an eye or 2 eyes.
Well, the
Yeah.
interesting thing is we've seen the same thing happen with thyroids when ladies have had partial thyroidectomies, where they only take half of the thyroid because of cysts, polyps. I don't know. They've got given irradiated iodine, and then it destroyed the thyroid for whatever reason. We've had ladies whose they've had the right lobe of the thyroid removed, and then it begins to grow back. So rather than it being only half a thyroid, you have 3/4 of a thyroid. It begins to grow back. From what I understand, they did this by using thyroid glandulars, which are dried and crushed cow thyroid. So they take the offal, the thyroid, and they dry it out and they bash it up and put it into capsule form, and you take it. And the body recognizes that as thyroid tissue and uses it to rebuild your thyroid tissue. Once again, it's only been done. We only have anecdotal evidence that this has happened. So we only have stories and, from doctors and from other patients who've said, this lady's thyroid should be going the other way. In fact, it's regrowing or it's healing or it's regenerating,
It's
it's
crazy.
interesting.
It's
Yeah.
functioning. Yeah.
Yeah. So it's really interesting. Like we have a body that is self-repairing and self, regenerating and
Yeah.
self-repairing. So
The
um,
important parts anyway.
yeah, like,
The longevity. Yeah.
yeah. So it's really interesting. Really, really
It actually
interesting.
makes you wonder if the human skin, if the epidermis was actually placed in like some sort of fluid and then given time to regenerate, it would be interesting to see if the body would actually heal itself without external factors like UV rays,
You know how
wind, damage.
a lizard can regrow its tail? You know how when
No.
a lizard can lose its tail, it actually
Yes. Yeah.
loses its tail as a defense. It
Yeah.
can
It disconnects.
it regrows that tail. Now, when they studied it, what they realized was that so all the nerve endings in our hands and all the membranes in our cells are all positively charged. But when a lizard regrows its tail, it reverses the polarity of the membrane of its cells, and that somehow allows it to grow. So it wouldn't surprise me if
Damn.
they actually know how to do it.
Working on that now. Yeah.
Well, that was a few years ago when I read that little one, but yeah, it was an interesting little. I think I can't
But there's
remember
no
where I
money
read
in
it.
it. That's why they're just making robotics
Yeah,
charge people like 10 grand for robotics.
they've learned how to regrow teeth using stem cells. So they have a little cap that goes on your root, and it has stem cells in it, and the stem cells then regrow the tooth.
That's
So
cool. That's very handy.
yeah.
I could definitely do with that.
So it is interesting. It can be done, but interesting. We got a little off topic there, bro, but that was interesting.
No, that's all right. It's interesting, but still, like, it's, that's what we're saying about the surgery. Like, if you cut it out, will it remain gone? For the lymphatic system, could they do a study and to find out if the actual whole lymph system will regenerate, is a regenerative system?
Well,
That'd be a great study.
here's why the reason I don't like lymph node or lymph tissue removal is because we see it mostly when women have a hysterectomy or something like that, or you have some sort of surgery in that pelvic reproductive area, and they remove a lymph node as they're doing surgery. They see a swollen lymph node, so they remove it, and then the patient then gets elephantitis in the leg, so swelling that elephant leg.
Yeah.
And what that is, that's trapped lymph fluid that cannot be siphoned back up the leg, because somewhere in that pelvic region is a severed lymph vessel, and so the fluid just flows out of that vessel and back down the leg with gravity.
Yeah.
And that's
People panic. We have like people who recognize edema, on the chest, on the leg, and go, he's got internal bleeding. There's probably a severed femoral artery or a aortic artery and stuff like that, or there's collapsed lung, but nobody thinks about the lymphatic system because it's long term. It's not, you're not dying within minutes or an hour. It's months of excruciating lifestyle of discomfort and that's horrible. But yeah, it's the same thing. You sever a lymph, what would you call it? A lymph vessel?
Lymph vessel.
It leaks into the body in the same way as an artery would, I guess. Well, a vein,
That's why a lot of women who have lymph nodes taken out, like under their arms and that sort of thing, because it's swollen or whatever, rather than dealing with the underlying cause of that, they remove the lymph node. I've seen ladies who don't have that vessel reconnected, and so there's no lymph flow out of the breast, and the breast swells and all that. So it's terrible. It's crazy. But if you can help it, don't have your tonsils and adenoids removed. Find a naturopath or a functional medicine practitioner who can help you.
Yeah, it is. Because I was actually about to ask you, why do you keep saying women? Women. Why do you say women?
Well, men don't tend to really get lymph nodes removed because women, for example, have procedures for things like endometriosis and ovarian cysts and these sort of things. And so what happens is when they open them up, they find swollen lymph nodes, which is normal around those sort of acid conditions. And they just remove them. Without permission, they just remove them. What else is there? It just seems to happen in women more than men. Men just don't have operations. Like if I go get a vasectomy, they're not going anywhere near my lymph nodes.
They're not seeing your lymph nodes. Yeah. Got it. But that's crazy that they would just cut out like, stressed lymph node and stuff like that.
Mm-hmm. Oh, bro, I lost you.
Okay, I'm coming back.
That's all right. So yeah.
There you go, I'm back. Yep. Yeah, so just things like that. It's crazy. Just crazy.
Yeah, my advice, don't get them removed. Anyway.
Yeah. Yep, sorry. Yeah, so we pretty much, okay, let's talk about like what would you recommend for if a parent did come in, if a parent did come in with a child that was uh, showing early signs of tonsillitis in a sinusitis, no,
No, yeah,
adenoid, yeah,
adenoiditis, yeah,
adenoiditis, yeah.
which most people would call sinusitis, yeah.
Okay, yeah. What would you recommend? So
So first of
straight away,
all,
you said get rid of milk. Get
yeah, get
milk,
rid of the
cheese,
milk.
get rid of it.
Get rid of the
Yeah.
milk, get rid of the cheese, get that child on more fruit. I say fruit because it's easier to feed a child fruit than it is to feed them vegetables. So get up high on the fruit, eat lots of fruit, lots of berries, lots of melons.
No candy.
Yeah, no,
Not
no,
these candies yet.
you need
Yep.
to eat. Now with kids, it's hard to get herbal medicine into kids, so I'm always reluctant. But having said that, my last few young clients, they took to it like, fish to a water. They really didn't
Is
seem
it
to worry about the taste.
what is it that makes it taste good in there? There's that licorice root. Is it licorice
Licorice
root
root,
that makes it
yeah,
taste? Oh, so good.
licorice root, bilberry, schizandra berry. Yeah, they're pretty
Yeah.
much about the only good ones. Yeah,
Yeah. Everything else just tastes
yeah,
awful.
awful.
But if it tastes bad, it's probably good for you.
Exactly. Yeah. So
Yeah.
I would be so if I had a child that would take herbal medicine, I'd be giving them echinacea straight away because echinacea is an amazing. We call it an immune herb, but in fact, it's a lymphatic herb. So it moves the lymphatic system, so it helps to drain away that swelling. Burdock, I'd be going for anything like for the kidneys, so nettle seed, dandelion leaf, uh, buchu, or corn silk, couch grass, anything like that that gets the kidneys moving. Burdock root is really interesting. It helps to move a lot of that built up metabolic waste in the lymphatic system and gets it moving down towards the kidneys. Really important. And then anything that is anticoagulant for the lymphatic system, not the blood, for the lymphatic system. So that's your cancer herbs like chaparral, uh, graviola fruit, which is soursop. You can take gumpy. You'd be able to take. What else have we got? Rhodiola.
What about things they can do at home? I know, like we always talk about, like move so the lymphatic system can operate. So
Yep.
like,
Move.
don't let the kid, don't keep the kid on the couch lying watching TV all day. Go for a walk.
Absolutely.
Let them play.
Let
If
them
they're
run
up for it,
free.
let them play. If they're
Cold.
not, get them up. Huh?
Cold. If you can
Sorry.
get them, if it's a cold climate, get them outside. The cold is excellent. It's just going to get everything moving. The cold, for some reason, cold moves the lymphatic system, and hot coagulates the lymphatic system. It's strange. It seems completely, like reversed.
Counterintuitive, yeah.
Perfect. Counterintuitive. It is. It feels that way, but that's how it works. Hot, coagulates it, and cold helps it move. It's really interesting. It's very, like I say, counterintuitive, but that's how it works. So the cold gets everything moving. It'll get your nose running. It'll get your mucus in your throat going. Swell. Cold helps to bring down swelling. Like they say, ice it. And so being in cold environment does that as well. If you're in a cold environment as well, like a cold place, you can do hot and cold showers. So you can just turn the hot water off in the shower and let it run freezing cold on them, and then quickly turn it back to warm again. Do that 3 or 4 times every time they have a shower, and that helps as well. All these things help. Yeah. Another
But I
crazy.
guess the main thing, that people can do at home is just really diet, isn't it?
Yeah, absolutely. If you live in a hot climate, there is one thing you can do. They call it the cold sheet therapy. It's where you take a sheet that you can wrap them in, and you fold it up and put it in the freezer for the day. And then when it comes nighttime, you bring it out and you wrap them in them and put them to bed in it. And that's for hot climates, like tropical climates where you can't get cold water because you're
Like
cold.
you.
Yeah, like the cold water tap runs hot. So there's no cold water. So you can do that as well. It all works. Yeah, but what the whole idea of this is to move the lymphatic system. Yeah, food, fruit. Fruit is like the best thing. Turn your child into a fruit bat. take them off all the dairy and the milk, get them onto a fruit, and just keep them on it. Feed them lots and lots of fruit, and then it just counteracts all the junk that they eat as well, because the kids, they're gonna, somebody brings cupcakes or lollies to school, they're not going to be like, I'm not eating that, I'm not allowed to eat that. They're just going to hoe into that stuff. So if you're feeding them fruit at home and they've got fruit for their lunch boxes and things like that, then yeah, you'll see a huge difference. 3 months down the track, you'll have a different child. There'll be no swelling, tonsils, no swelling adenoids. Yeah, these are Western conditions that you find in Western society that you won't find in other cultures that are not doing these sort of things. So yeah.
I think we're in a time now. Like, I think we've been in this time for many, many years, but with the net 2.0, so the way the internet is now and information and stuff like that, I think we're in this time where so many people, especially our age, are just we're finding things out, and just how counterintuitive everything is. So everything that we know, all the information that we were taught in school, is actually wrong. Like, that's probably the hardest thing to accept, is that almost everything we learned, every book you picked up has been paid for by an industry, and so nutritional pyramids are incorrect and things like that. And I think
it's conflict of interest.
Our reality. It's our reality. Our reality now, at this point in the middle of our life, our reality is being smashed. It's almost like a Matrix moment where nothing's correct. Like you could get up and you'd eat like a breakfast cereal, and then in 2019 people are showing you on the internet that the breakfast aisle is disgusting and full of sugar and it's bad for you, and there's not one healthy thing in the breakfast aisle.
Yeah,
that's right. You could literally remove the breakfast aisle from a supermarket and watch a nation, a first world country, like population of first world people become healthy within 6 weeks. Like, it's like here in Denmark, cigarettes and alcohol is cheap as chips. Like, it is cheap as chips. Like,
a couple of bucks.
You can go in Australia. So Australia's problem is that the candy's cheap in Coles. You can walk in and grab a $2 bag of candy, massive $2 bag of candy, and you can do exactly the same thing here with beer. So you can walk in and buy a can of beer for $2. Or what I should say is every can of beer is $2. So
cheap.
It's cheap. And so you can see how and cigarettes in Australia are very, very expensive. Cigarettes here are very, very cheap. And everywhere you go, people are smoking. But in Australia, that's not really a problem anymore. You walk through cities and people are not smoking. And, within a circle of friends where 90% of people smoked, within 5 years now, nobody smokes. Because it's too expensive. It's the same with this idea. If you took away the middle part of the shopping center, of the supermarket, this is the kind of changes that you'd see. You'd see a nation of people, you'd watch their illness levels drop, and
definitely
lifestyle problems, obesity would drop. So it'll never happen.
I want to leave everyone with one little bit of wisdom before we leave, before we get to our next episode. So whenever you go looking at a food, I want you to look at the physiological effect that food will have on you, and then look at the nutritional value. Because one of the biggest mistakes we make is we assume that because a food is on point with its nutritional values, that it's actually good for us. A perfect example of that is milk. Milk, when you look at milk from a nutritional point of view, it's absolutely on point. But when you look at it from a physiological point of view, you realize how damaging that food truly is. And that is the case with a lot of what we eat. So physiological effects over nutritional values. So yeah,
Nice.
hopefully that wraps that up for you. No worries,
Yeah.
my man. So thank you so much
Okay,
for this.
awesome. Yeah, it's been good chatting. I'll see you in the next episode.
No worries. All right. Thank
Okay.
you very
Bye.
much. Talk to you later.